sure all of you must be keeping good health. I am Sanya from All About Skin Well-being. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important more than just your appearance. As the largest organ, your skin becomes most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infection or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal infection can look like a rash and can be itchy and annoying. So let's connect today with skin expert Dr. Priyadarshini K, live from Bangalore, to enlighten us in the topic of fungal. Dr. Priyadarshini K is an expert pediatric dermatologist from RGUSS with over 15 years of medical experience, and she has worked in both public and private sectors. She has trained in all relevant fields of dermatology, including dermatosurgery, aesthetic dermatology, and geriatric dermatology. She also has multiple publications in recognized medical journals of dermatology. Dr. Priyadarshini K, we welcome you today.
Thank you for having me on the show, and I hope we can discuss and
And Doctor,
enlighten
as
our
we are going to
viewers with.
discuss a very important topic, that is fungal.
Yes,
Definitely,
yes.
definitely. And Doctor, we are going to discuss a very important topic, that is fungal infection. So my very first question to you is, what is basically fungal infection? How we can define fungal infection?
So, fungal infections are very, very much common in India. A lot of people have most often undergone it at least once in their lifetime. A lot of these infections can range from very mild dandruff, yes, dandruff itself can be a form of fungal infection, to a very serious, life threatening like situation, which probably became very famous during the COVID era. So it can be as variable as that, but it is very notorious, and hence public information should be made vital uh, to anybody who is willing to listen. Fungal
Yes,
infections
definitely,
are
Doctor. And we are here to discuss more about it.
So fungal infections are very commonly seen, in our environment. Like I mentioned, it is very common in India. It is very prevalent in India because of the kind of weather patterns that we see here. We being a very tropical country, the fungi love to grow in these kind of temperatures. It doesn't mean that it's not seen throughout the world. Of course, it is. The different variations of how you can see it and how a person experiences it. But in our country, it is extremely prevalent because of these the temperature conditions, the population that exists in closed environments, in closed, crowded situations, and also the hygienic issues that we can face in our country. We are still a developing nation, so all of these matters to the prevalence of fungal infections in our population. Like I mentioned, it can be very mild, it can be it can be exhaustive. So superficial infections are usually something that most often is encountered in a lot of people. Then we also have something called as the subcutaneous or the dermal infections of the fungi, which is again seen in populations of a certain criteria. Like, they're coming from a certain professional background. Farmers, example, they see it in those kind of situations. Then you have the deep mycosis, which are seen in the immunocompromised people, people with, issues of uh, most often associated with HIV and things like that. So, fungal infections can be that variable, and hence, educating the public about it is something which I think a lot of dermatologists love to do.
Right, absolutely right, doctor. And as you have mentioned that fungal infection can be of various types, from mild to harsh as well. What are the symptoms of fungal infection? How someone, if is having fungal infection, can make sure that this is particularly fungal infection, and he or she needs to go to a dermatologist.
Yes, so fungal infections are actually very easily identifiable. So easily identifiable that even your great grandmother or a grandmother in the family will tell you, "Oh, this is definitely a fungal infection." So all you have to do is just apply this and it goes away. It's that commonly seen, and the most common symptom, of course, is an itch. But it also, it can be seen along with a red rash. So red rash and an itch. Most often, people will say, "Oh, it is a fungal infection." Very colloquially, it can be called in, like in Karnataka, it is called as an hulkadi infection. So it's very variable. It's very colloquially named as well in a lot of states of India. Very easily identifiable. So, like I mentioned, your elders in the family will identify it for you, and unfortunately treat you for it also the same way. So, as long as you're noticing something happening and not responding to the home remedy portion of it, best to get it checked out by your dermatologist, treat it accordingly, and it's just as easily gone as well. So, the most common symptom is the red rash and severe itching. Yes.
Okay, doctor. So red rash and itching are the main symptoms if somebody is having such kind of symptoms. Doctor, as you have mentioned about home remedies as well, that someone will definitely tell that this is the fungal infection. Talking about home remedies, most of the people take home remedies or over-the-counter medication or referred by a friend that I had fungal infection. I applied this cream. What is your advice to those people who take over-the-counter medications, home remedies, or anything suggested by their friend?
Two simple words: please avoid. Anything that comes in the form of a home remedy for any kind of medical related conditions, always please avoid, because these are very easily salvageable situations. You can easily get rid of them. It's that simple. It's an infection, so it's easy to get rid of. But when you take a home remedy for it, or take an unadvised medical I mean, sorry, an unadvised cream for it, which is again hugely prevalent in India. It's so common. You just go to the medical store and the pharmacy guy will give you a cream and he'll say, "This will work for you." Very common names present in the community. People pick it up. They just go to the medical store and someone will say, "I'm having itching in my private area." This is the most common, right? People having itching in their private area, people having itching in their underarm area. Then they'll say, "Oh, it's a fungal infection. Please use this," and you're sorted. Of course, they're sorted because you're using a cream, so your itching has improved. But it boomerangs, or you develop something called as a resistant form of a fungal infection. So please avoid these unnecessary situations. Excuse me. Avoid these unnecessary situations and get it sorted. All you have to do is just meet the dermatologist and take the short course of treatment, and you're completely sorted. Not only you, your whole family can get sorted because it's contagious also in quite a few people, in quite a few populations. So you're saving not just money on this, you're saving your whole family a lot of mental stress as well.
Absolutely right, doctor. So, as you said, please avoid. That is your advice to the people who take over the counter medication, home remedies, and do not go to a dermatologist instead of treating themselves. Doctor, as you have also mentioned that it is contagious. So, what kind of fungal infection are contagious? What precautions one should take to protect the people around?
Yes. So most often, fungal infections are really the non-contagious kind. See, like I mentioned, even dandruff can be a form of fungal infection, but it doesn't mean that a person in the family has a dandruff and if the other members should also get it. It's not necessarily so. But if it is untreated and it is the kind wherein there's a lot of mixed infections happening, yes, it can be contagious. They can also be contagious in situations wherein there's close contacts and the person hasn't been treated per se. Then it can become contagious. So hygiene matters. Close contact matters. In children in a boarding school, children who live together, adults and children who are sleeping in the same crowded space but are not maintaining hygiene. These are the situations which make these fungal infections grow out more rapidly and resistant to treatment as well. So it makes sense to get it sorted at the earliest. In fact, closed environments are a huge reason as to why fungal infections can persist, along with the fact that they use over the counter creams or home remedies. And that's when resistance develops and it brings in unnecessary trauma to everybody concerned.
Okay, okay, doctor. So it can be contagious. Some of the fungal infections can be contagious, and one should take proper care. Doctor, is it season-wise, or somebody wearing tight clothes? Does it also triggers fungal infections? And does some food items also trigger fungal infections in people?
No, do not have any onset with respect to any kind of fungal infections. Until and unless you're allergic to food itself per se, it's not really a concern. Tight clothing, yes, because one of the very common conditions which is associated with fungal infections is not breathable fabric, very tight clothing, and when you have a predisposition towards getting it, you will end up with a fungal itch. So clothing does matter, yes.
Okay, doctor.
Wearing
So the clothing does
loose,
match.
yes, wearing loose, comfortable, free breathing fabrics do matter. But again, in our country, that can be a little bit of a tricky situation. So, as much as possible, they should be using something which is very easy and comfortable. Like people who are used to using lungis, if their profession allows it, they can wear that. Especially if they are experiencing a fungal infection. But otherwise, cool, comfortable clothing should be a priority.
Okay, doctor. And we are discussing about fungal infections. We have discussed about the symptoms, the precautions one should take. Now, coming to the treatment part of fungal infection, how are fungal infection treated? Are there any antifungal medicines? How one person and how long does the medications take?
Antifungal medications are given on the type of area that the fungal infections infest. So sometimes we see it on the body at that point of time. Just using a cream helps. But if it is involving more than that, then we do advise them to take in both an oral medication and as well as a cream application. If it is present on the scalp, like fungal infections in the scalp, not accepting dandruff, we do put them on both oral medications. There are severe forms of fungal infections that we see in children, especially people, kids who are in boarding schools and kids who go to unhygienic power places. We do see the more resistant forms of, on the severe forms of fungal infections of the scalp. These are much more prolonged, delayed forms of treatment. So it involves both tablets for an extended period of time plus applications. And here, it's really, really important that the parent and the child take care of themselves in a particular manner. So, treatment options are based upon the kind of infections that they have. Like, for example, in women, fungal infections in the perimenopausal or the menopausal group is again very, very high. They tend to catch it very easily. So, at that point of time, we use only oral. Oral forms are more than sufficient. But then at the intensity of these kind of medications has become so drastic and dramatic because people just go to the medical store or use their home environment or use their neighbor's advice and use something. They end up developing resistance. So resistance, treating resistant form of fungal infections is becoming like a huge bothersome issue for us right now. We are trying to educate the public a lot more, and I think I'm hoping that these kind of endeavors makes it much better for them to understand what is happening. But in these kind of situations, we are ourselves trying to sometimes use cream A and then move on to a cream B or move on to a drug C or a drug D. So medications are very important and very vital for these kind of situations. Yes. We have also started including gynecologists a lot of time for our perimenopausal and menopausal infections because it can become very tricky at this point of time, and a combination overlap of infections happens. Sometimes it will just be a fungal moved on to a bacterial or a viral. and a gynecologist comes in, and both of us work together to make the situation better.
Definitely. And educating people is the most important thing, as you have already told, doctor. Sometimes people also don't take full medications of antifungal. They ignore it. They thought that the itching is gone, the redness is gone. So they stop taking the medication. Is there any chances that if they do not take the full treatment, the fungal infection will occur again and again?
Oh my God, that is such a wonderful point that you brought out. Yes, people see a lot of difference once they've started treatment, because obviously they're doing something about it, so it will start responding. And any infections, when treated correctly, will respond very fast. So they assume it's okay to stop treatment as soon as I'm asymptomatic. That is when they don't have any more itching, or they see the rash getting better and has almost become negligible. So they just think that, oh, you know what, mera ho gaya. I'm just done. I'm just going to stop. But unfortunately, fungal infections are notorious. They love your skin. They'll just stay back and they'll come back. They'll come back in a boomeranging way, or they'll come back in a resistant format, or they would have spread to somebody else. So you're recatching it. So there's a rebound effect. So it can come back in so many more ways and make it much more trickier. So it's just easy to do your 4 week of routine of treating it in a simple manner, then just get it sorted. So please avoid doing these cutting short of treatment protocols. It happens with antibiotic resistance. It happens with antifungals as well. So yes, please do take forward the whole routine as advised by your dermatologist.
Absolutely, doctor. And doctor, as antifungals are safe to take long term, is it like that if somebody is taking antifungal for the long term, is it safe?
Antifungals are usually safe. There are, of course, see, every medicine has its pros and cons, but most antifungals that we advise in the general population are of the safer kind. For the infection, for the deeper infection kind, we always take care before providing them with the antifungals. But most often, these medications are pretty much safe to use. There shouldn't usually be any kind of drug reaction or anything. But then everybody's DNA is different, so we don't know who will react how to a medication. But on the whole, it is a pretty safe molecule. Yes, some molecules are very safe to use in them.
Okay, doctor. And you have also mentioned about the gynecologist. So here comes a question that can oral antifungal drugs be taken during pregnancy?
Yes, we do have medications that we use in pregnancy, which are safe to use. So we use them in pregnancy. We use them during the lactation period. That is, even when the breastfeeding process is happening, and it can also be used during for a newborn baby as well. If a baby has contracted a fungal infection because a mother has it or a parent has it, then yes, we can treat the child as well. So there are that kind of safe antifungals as well in the market. Yes.
Okay, so after consulting the doctor, people can take the antifungal, but as Dr. Priyadarshini already mentioned, that please do consult the dermatologist. Do not self-treat, avoid treating. Doctor, are there any age group, that particular, if children are going out and playing more, they'll have more prone to fungal infections, too young people who are working. And is there any age limit for fungal infection, or fungal infection can happen to anyone?
Yes. So, like I just said in my previous sentence, even a newborn baby can get it. It may be expressed a few days later, but no, there's no age barrier per se. Unfortunately, fungi, like I said, love India and our Indian skin probably. So they tend to affect most people, but it can also happen to anybody. Even if you're got an extremely healthy lifestyle, you can end up with a fungal infection. But if you do have other health situations, especially immunocompromised individuals, who we call them as, like people who have illnesses that have made them very sick and their immune system is really down, In them, they tend to catch fungal infections much more easily, much more frequently, and even the more notorious kind. So there is really no age barrier per se.
Okay, so there is no age barrier. Anyone can have fungal infection. Doctor, one more question that sometimes people have fungal infection. They do not treat it and, life through, they just apply some home remedy or something suggested by someone. Is it like that if somebody is not treating a fungal infection, are fungal infection generation is genetic?
No, fungal infections are not genetic at all. In fact, there are some variants which are present, which can be, transmitted per se, but they're not genetic. No, they're literally an infectious background. So it's not inherited per se.
Okay,
But
and if
family
somebody,
can transfer them. So a
okay.
person in a family has it and they haven't treated them right, or they haven't treated them at all, or they've treated them with, say, like we were talking, right? You asked me about the medical stores and over the counter medications. So generally these come with what is called as the triple combination, which is using a steroid cream in it, which is using an antifungal and an antibacterial combination. But the notorious agent over here is the steroid. So when a person has used these kind of things, it can transfer in the family, but it's not inherited.
Okay, doctor. So it's not inherited. And what is the worst case scenario if do not somebody do not treat fungal infection? How it can affect their body and health?
So again, I think that's a really nice question for the public to understand, uh, because this can become prolonged if you don't treat it right, and it can become a burden because you're itching yourself in all the wrong places at all the wrong times, and it can become very embarrassing sometimes, to the extent that we have also encountered people who have had who have gone into social isolation because they feel that they're itching themselves at all the wrong times, at all the wrong spaces. They're meeting people, and in public they're doing these kind of activities, and it becomes very offensive as well socially. So yes, it can be a burden in that matter. It can become like a mental burden, it can become like a social burden, it can become like a psychological burden if it is not treated. So coming back to that perspective, treatment is very simple. You just have to meet your dermatologist and it's sorted. But if you don't, it can become, like a cycle response. You're getting yourself sorted out, somebody else in the family has it, but they are not treating themselves. It can come back again to you, and it can go to a third member, it can go to a close friend, it can go to a child in somebody else's family. In somebody else's family there's a person with low immunity, they can contract it, so you're also spreading it. So it can become a big burden in that format if not taken care of, and hence treatment just keeps on extending. So steroids are really a big abuse at this point of time. Incomplete treatment is a big abuse at this point of time. So if you just get yourself sorted right from the start, and if your dermatologist is confused, they do simple tests as well. They can do a simple scrape test, they can do a culture depending upon what is happening. And if it is really really even more tricky, nowadays there are a little bit more advanced tests called as PCR tests also, which are done. So dermatologists have a lot of things in their kit to get you sorted, so that your treatment is much more faster and much more effective and doesn't have to be prolonged.
Right, doctor, and very well said, doctor. That dermatologists know how to treat the fungal infection. So, if you are having any kind of symptoms, please do refer to a dermatologist. Doctor, we had discussed about the symptoms, the precaution, how to treat the fungal infection. Before we end this very informative live session, any takeaway message you would like to give to all our viewers watching this?
The single most important takeaway is, please do not rely on your friends, neighbors, or your elders in the family, or a good friend who comes out with advice saying that this cream works. No, it may have worked for them, but then we don't know if it will work for you. Meet your dermatologist and get it sorted. That is really the single most important takeaway. The second most important thing is, do not feel shy to approach a doctor if you're having an issue. Because a lot of people find that it's in their private area, it's in an inaccessible area, so they feel very shy about approaching a doctor. You shouldn't, because that's what a doctor is there for. That is, what we do. That's our job. Like, when we know what we have to do, we will do it accordingly. So don't feel shy. Please approach them. Get it sorted. It's as simple. Infections are really one of the easiest things and the fastest things to get sorted in skin, unlike so many other conditions. And especially if you're in a certain age group, like children, pregnant women, menopausal, perimenopausal women, diabetics, men who are in a certain profession which requires them to use certain kind of clothing for prolonged periods of time, especially from the entertainment industry, when they're using a lot of clothing which is reused or not really cleaned very well. They are the kind of people who tend to get these kind of infections faster. So just meet them and get it sorted. It's just gone. So two single important takeaways are these.
That are absolutely. I think for all our viewers and watching this live and very informative takeaway that treat the fungal infection properly. And thank you so much, Dr. Priyadarshini K, for your valuable time. And it has been quite an informative session for our viewers. And we really look forward for many more such sessions in the coming time, as well, Doctor.
Thank you so much for having me. And I hope you all do take time out for yourselves whenever you have any kind of situations. Remember, it may seem like it may be an external aspect, but skin really is the largest organ of your body. So take care of it well.
Absolutely. The skin is the largest organ, so please take care of it. Thank you so much, Dr. Priyadarshini K, for a very informative session. And thank you so much to all our viewers. And for more information and updates on skin health and care, stay connected on our Facebook page that is all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Thank you and good day to you all.
Thank you very much for having me once again. Take care.